Hello, I'm Jane Williams. Welcome to Webinar 1 in our General Practice Accreditation series, Getting Started. Country SAPHN acknowledges the traditional custodians of the lands we live and work on and pay respects to the elders, past, present and emerging. We recognise and respect the unique cultural and spiritual relationships to the land, waters and seas, which continue to be important to Aboriginal and Torres Strait Islander people today. In this webinar, we will cover registration, self-assessment, the patient survey, and the policies and procedure manual. The registration process. Contact by accreditation body. 12 months or so from the expiry of your accreditation certificate, your accreditation body will contact the practice to begin the process of re-accreditation. The accrediting companies. There are 2 accrediting companies, AgPal and GPA. Please note that the practice referred to in this webinar series describes those from AgPal. Also note, GPA is now QPA, Quality Practice Accreditation. Accreditation against the RACGP's 5th edition standards. Whilst the processes of each company may differ, the end result is that all practices are accredited against the same set of standards, in this case, the RACGP's 5th edition standard. Self-assessment. Receive a re-registration and self-assessment fee invoice. When a practice is due for re-accreditation, they will automatically be sent a re-registered and self-assessment fee invoice. Accreditation Pro. Once this initial invoice is paid, the practice gains a unique access to their online AgPal Accreditation Hub, Education and Resource Library, and self-assessment tool Accreditation Pro. Self-assessment is an internally led process, where practices determine the degree to which they meet the requirements of the standards. The Accreditation Pro guides the practice through the self-assessment process. This process ensures identity compliance and where improvements may need to be made prior to an on-site accreditation assessment. Submission of self-assessment. The practice submits its completed self-assessment. Submission is a paperless and fully automated process. Submission indicates that the practice is ready for the on-site accreditation assessment. Patient survey. A patient survey is conducted as part of the process of accreditation. Using patient feedback assists in improving services to patients. You are the expert about your practice, but are you the only expert? You probably feel that you know everything about your practice, which GPs are in demand, which days of the week the phones run hot, which staff are best on which roster, and that the practice follow-up system is effective. Do you know what patients say about their experience of going to the doctor and what they are willing to put up with to see a particular doctor and what they think could be done differently? No doubt you are the expert about your practice, but are you the only expert? Developing an RACGP approved practice-specific questionnaire. Your practice can develop a practice-specific questionnaire that will need to be approved by the RACGP, or you can purchase one of several on the market, which addresses generic questions for patients to answer. The benefits of a practice survey. Developing a practice survey will enable you to ask questions specific to your patients, your practice, and your GPs. This will give you direct insight into the feedback. Practice surveys assessed by a third party. These surveys are assessed by a third party and returned to the practice so the results can be acted upon. When you receive these results, they need to be addressed by the practice. It is recommended that you convey the results to the patients and also advise them of the changes that will be made to address any issues raised. Survey available for the assessors. This survey must be available for the assessors at the on-site accreditation. What is a policy and procedure manual? A policy and procedure manual is where all the policies and procedures relating to the practice are stored. In the past, and still being used today, are paper manuals. However, there are some now that are cloud-based. Where to access the Policy and Procedure Manual? If you're using AgPal, there is one in Accreditation Pro. QIP, which is a subsidiary of AgPal, has one that can be accessed for free, and AAPM has a template which can be purchased. Practice Hub, or Focus Accreditation. There is a program called Practice Hub which stores all the necessary documentation for the practice. This comes at a cost. There is also a company called Focus Accreditation, which has various levels of support to purchase as well. Up-to-date policies and procedures. The most important thing to remember is to keep all policies and procedures up to date. Make certain that you put a date on the policies when reviewed and a forward date for when they are likely to be reviewed in the future. One of my favourite sayings is Accreditation Day is every day. Policies are priceless and you should update them every 6 months. By doing this, you keep ahead of the game. Follow this list and it will enable you to be well prepared. Review all your policies and procedures. Gap analysis. Your review may well show up gaps that need reviewing. Plan with a deadline. Plan to make the necessary changes and ensure you mark a deadline for this. This is most important. Action your plans which showed up in the gap analysis. Review all the changes which need to be made and delegate where possible, taking into account everyone's workload. Then repeat all of the above 6 months later. Thank you for taking the time to join this webinar today. Country SA PHN gratefully acknowledges the financial and other support from the Australian Government Department of Health. For resources, you can email us at support@countrysapphn.com.au. Resources can also be found online at agpal.com.au and the 5th edition standards from the RACGP.